my name is Andre Latau, and I am a FNP student at Youngstown State University. And here with me, I have an advanced practice registered nurse. And what we will be doing is an interview. It should take about 5 minutes or so. And can you tell me your name and your title?
Hi, my name is Matthew Jones. I'm a family nurse practitioner.
All right. And can you tell me a little bit of your background and your education?
Yes, I became a nurse practitioner a year ago. I went to Youngstown State University. I was an LPN for about 4 years. I went to Tri-C to become a LPN. Then I became an RN at Lakeland, and I got my bachelor's degree from Ohio University.
All right, very good. So can you describe your position and your specialty and the types of patients that you see?
I am a family nurse practitioner and I work in urgent care. I work for Cleveland Urgent Care and I see patients of all ages and all ranges. I see patients as young as 2 years old and I've seen patients as old as 92.
All right, very good. So you see a wide variety of patients
I do,
then.
yes.
Now, how would you say, do you feel like there's an overall influence of APRNs within the healthcare system?
I do. We are very influential by giving access to patients. A lot of patients tell me they have to wait a couple months to see their dermatologist or their endocrinologist or their cardiologist, and they may just need a refill of their medication. So a lot of times we come in need with that, but we are the advanced practice nurse is the mid-level provider that actually gives referrals and helps patients that are in need.
All right, good. And oftentimes I've heard a lot of people say that when they see the nurse practitioner, it's better than even seeing the physician.
I've heard that too.
All right. Now, what would you say the barriers are with your job and with advanced practice nurses right now?
Some barriers that nurses, advanced practice nurses, see are we have to pay attention to the different formularies. Some patients and their insurance won't cover certain medications. Sometimes certain medications need prior authorizations. Certain medications have a very large cost that patients have to pay. So financially, we see a problem. And then geographically, we also see a problem. A lot of patients that live in rural areas aren't able to get to hospitals or doctor's offices or urgent cares. So those barriers that patients have, the APRN also has as well.
Okay. All right. Very good. Thank you for answering that. And kind of going along with that questions, what changes would you like to see for the APRN, like in the future of healthcare?
Well, I know in some states, the APRN is able to practice alone without a collaborating physician. I would definitely like to see that in all states, the APRN is able to practice alone. That is a very important factor. Although I do have a collaborating physician, if I did not have a collaborating physician, I still would be very valuable to the healthcare community. But I think that is something that we should be able to do.
All right. Yeah, and I totally agree with you. So I just wanted to say thank you for answering these questions and for doing this interview, and I hope you have a good rest of your day.
Thank you. You have a good day as well.
Thank you.